Could you just tell a little bit about who you are, where you live, and what you do for fun?
So my name is Lemma. I'm a registered dietitian and I'm also a diabetes coach. And I work mostly with women who are women, people who are planning for pregnancy, who have type 1 diabetes, and people who are currently pregnant or maybe are new to parenthood with pregnancy and balancing the two, because that can be really challenging. I also work on occasion with people who also have gestational diabetes as well. And I live in Harrisonburg, Virginia, and I have two kids and I'm married. So juggling all of that has been really interesting. And I love to do a lot of things for fun. I feel like I don't get to do them very often, balancing everything. But if I have time and I have a window, I usually choose to do something active outside. I love to bike and run, and my husband and I occasionally go rock climbing. We used to go a lot. We don't go as much now, but we try our best to still get out in the winter and ski and hike and just we live in a wonderful area for outdoor activities. So that at least makes it easy. And we try to encourage our kids to come with us. And that's been really fun. It's also been a little bit humbling because, like, we can't go as far with them or hike as far, but it's really fun to see the outdoors through their eyes. And it's been really motivating and encouraging. And we've been enjoying it.
How many kids do you have?
I have two.
What are their ages?
My daughter is 4 and my son is 20 months. So he's almost 2.
Oh, that's so great. That's great that they're going to be like close in age too.
Yeah. Yeah, and they get along really well. It's super sweet. I wasn't sure, and they're a boy and a girl, and I grew up with a sister, so I wasn't sure how they would get along, but they get along so well, and it's really sweet.
That's adorable. I love it. And you have type 1 diabetes yourself.
I do. Yes.
When were you diagnosed?
I was diagnosed at 19. So I feel like I was diagnosed a little bit older in life, and I've had it for almost 20 years. But I wasn't a child when I was diagnosed, which I know people are diagnosed at all different ages, but I feel like at the time for me, that was kind of different.
Hmm. Can you tell us about your diagnosis story?
Yeah, I feel like it was different because I was misdiagnosed a couple of times
Really?
because I was older. I kept going to the doctor and they kept diagnosing me with other autoimmune issues. Like I also have thyroid disease, and I also have some issues with celiac as well. And I feel like every time I would see someone, it's like I feel like we're missing the mark though. Like I'm still sick is the problem. And eventually I was able to see a doctor, a specialist, an endocrinologist who figured it out. And he finally checked my blood sugar and checked everything he needed to check. And he's like, you have type 1 diabetes. And I had had it for months and it just was getting worse and worse. I was in college trying to balance my course load and be social and have friends, and I couldn't even get out of bed. I just was like totally had no energy, and I felt so sick. And I was so fortunate to find this doctor to help me and get me like back on track a little bit and help me figure things out. But it was really daunting in college, like all of these new autoimmune conditions. And also, I felt like I didn't have a lot of resources other than my physician. And it was really tough, honestly. And I've talked to other people, they've had similar stories to mine.
I can't imagine being in college because that's like a time when you're just trying to figure out life in general and then you throw that into the mix. That is crazy.
Yeah, it really was. I ended up taking the rest of the semester off. It was second semester of my freshman year, and I'm glad I did. And I just withdrew and I was like, I just need to go home and figure my life out and take summer classes and catch back up. I'm so glad I did. But coming back the following year and figuring out eating and figuring out, taking my medicine, and also just be, like you said, being a new college student and wanting to, experience college things was really tough.
Oh, I bet.
Yeah.
And then I'm curious, just because you mentioned the other diseases. So when you say thyroid disease, do you mean like a hypo or hyperthyroidism, or what do you mean by that?
Yes, I was originally diagnosed with Graves' disease, and my thyroid gland was hyperactive. So it was overproducing thyroid hormone. And I didn't have it removed, but I ended up taking radioactive iodine treatment, which essentially kills your thyroid gland. So it's not producing as much as it was. And now I guess I have hypothyroidism because now I take a thyroid hormone to replace what my thyroid gland doesn't produce anymore.
I also have hypothyroidism. So you were diagnosed with that first.
Yes.
What age were you when you were diagnosed with that? Was
That I was diagnosed with that at 19 as well. I felt like I was throughout my like first year of college, I was like going to doctor's appointments trying to figure out why I was sick.
Gosh, that's crazy. And then you were also diagnosed with celiac?
Yes, I was because I was dealing with GI issues as well. And I was like, is this part of the thyroid disease? And they're like, not typically. So I feel like I was just kind of being bounced around to different doctors. Fortunately, I lived close to a big medical system and I was able to get the care that I needed. But it was so frustrating and I still didn't feel better. It was like, well, I feel like by figuring some of this out, I should feel different. I should feel better. And that was really frustrating.
So do you still follow a gluten-free diet?
I do. I've found in getting, my thyroid more managed and my diabetes more managed, I have actually figured out that I can be a little bit looser, which it probably doesn't really make sense, but I have found that, it's a little bit, it's not as severe as I originally thought when I was diagnosed early on.
This is so interesting just because I just went through the same thing this past summer. I was having all these weird reactions, ironically not GI, but I would get like rashes and I couldn't figure out why. And they thought it was celiac. It ended up not getting like fully diagnosed with celiac, but I have a sensitivity, so I just have cut it out. But it's
Yeah.
crazy how all the autoimmune diseases like work together. Like you get one and then they all just come.
I know, it really is. That's exactly how I feel too, and that's how I felt. And yes, I have more of a sensitivity as well, and it is crazy how it's all connected.
Yeah,
It can be.
well, I'm sorry that that all happened to you like in a 1 year period.
I know, I know. To thinking back on it is like, whoa, that's a lot.
Yeah,
Yeah, and I feel like I never really recovered from all of that, just all of that stuff that happened.
yeah. So tell us about your coaching practice.
Yeah, so my coaching practice, I originally started a few years ago just wanting to work with people who had diabetes in general, which I did do and I loved. But I was happened to be talking to another dietitian in the same space, and I was like, what I really would love to do. And I was planning for my second pregnancy, and I was remembering how my first pregnancy was it just was really stressful and harder than I felt like it needed to be. And I was thinking, you know what I'd really love to do? I would love to coach women who are, or women, people who are thinking about, becoming pregnant with type 1 diabetes or who are currently pregnant, because I know from my firsthand experience that this journey is like rocky and can be really tough. And I really wish I could go back and enjoy my pregnancy a little bit more and trust myself more and maybe push back a little bit more too sometimes, like on recommendations I'd received from my doctors or suggestions, or sometimes I felt pushed around a little bit. And in my second pregnancy, it's like I have so much more knowledge now. I know what's coming. I know what to consider. And I felt like there must be a gap because there must be a gap. Other people must feel this too. So then I decided to switch gears and just go into, at first, more the pregnancy part, because I knew there were other people out there like me who are maybe wanting a little bit more support, information that's specific for type 1 diabetes. Because usually when we look up information, we only find gestational, which is okay. There's many more people who have gestational diabetes, but it's not specific to type 1. And we kind of have to read between the lines and do the best we can with it. And I felt like we could do better. I was like, I feel like I can do better. I feel like people probably want this. And I've come to find out that they definitely do.
Yes, and I know I've reached out to you privately about it already.
Yeah.
So definitely because of what you just said, I've talked to my doctors about it, and I feel everything they say is very, I want to say wishy-washy. That's not maybe the right word, but like they're like, well, maybe, and I'm like, well, I just need a yes or no. Like I'm so
Yeah.
confused, and they're all like, well, you could, but you also couldn't, and so I'm like, okay, so that's good. I love that you do this.
Yeah. Oh, I'm so glad to hear that. And I remember talking to my doctor too, and she was supportive, but she basically only gave me a little bit of information like, well, you need to make sure your A1C is within this specific range. And at first I thought, well, my A1C has never been that low, so I don't know how I'm going to do that. And then the second thing I thought was like, well, how am I going to get there? Like, I have never been able to do this on my own. Who
Mhm.
can I talk to about this? And she literally had no information to offer me. And I felt that made me feel unsupported, but also lonely, and also it made me feel like, can I even do this? Because I don't know what to do next. So that's when I wanted to offer people to not I didn't want them to feel like it's something they can't do. It's something that they have to do on their own. It is easier than they think. And I feel like many of my clients definitely feel that way. They feel after we work together, they feel more confident, they feel much more informed, they feel better on their journey, which is what I want. I want people to feel good because it's really a cool journey. I mean, pregnancy is not all fun and games, but there sure are some fun parts of it. And really would like people to enjoy it more.
That's great. So were you on a pump on your pregnancies?
Yes, I was. I was on a pump both pregnancies. And on my first and during my first pregnancy, I didn't have a CGM or anything.
Oh,
Thinking back,
wow.
I was like, how did I check my blood sugar that much? My fingers were probably like totally scarred.
What pump were you on?
I was using a Medtronic Mini Med. I think I had a 630G maybe, and I actually used that during my second pregnancy as well, but I
Wow.
was also using a Dexcom. I considered switching to a different pump during pregnancy, but I honestly was so comfortable with the pump system I was using and the CGM and just making it work that I didn't want to switch to anything new during pregnancy my second time. So I decided to wait and I just stuck with the CGM, which I thought was so helpful the second time around, in my same pump, and it worked out just fine for me. And then I switched about a year ago to the Tandem T Slim, and I still have the Dexcom.
So I'm curious because I'm on MDI, and when I talk to the doctors, they all say I should switch to a pump.
Yeah.
I ideally don't really want to, like, just for my own sake, I don't really want
Yes.
to. So, like, what is your opinion on going on a pump for pregnancy?
Yeah, it's completely up to you. I've definitely worked with people who are using all different systems of management, and I think it's definitely up to your comfort, because my doctors were really pushing me like, you should switch to the Tandem, the best technology for pregnancy. And I was like, whoa, starting something new during pregnancy scares me. I don't want to do that. I want to do what I feel comfortable with and I know and can manage well. So I think it's completely up to you. I think there's a lot of advantages to using a pump, but again, I'm not for making people switch to things they don't feel comfortable with. So if the system you're using works well for you, you can absolutely make it work well during pregnancy. Like I said, I did finger sticks my first
Yeah.
pregnancy and it worked fine. I mean, it worked fine. So it can make anything work the best possible. MDI is a great system. And we also have some additional support with MDI to also make it a little bit easier too. So pumps are not the end all be all. They are nice for a lot of things, but they're not everyone's cup of tea.
Yeah, interesting. Okay.
Yeah.
And then what is like the typical range you're supposed to stay in when, well, I guess first, what is like your typical A1C you need to be before pregnancy? And then like while you're pregnant, what's the range you should stay in?
Yeah, I think the typical A1C that most physicians, endocrinologists might have a different number compared to an OBGYN or an MFM or a maternal fetal medicine specialist may encourage a lower A1C before becoming pregnant. They
Mhm.
might encourage an A1C of 6.5 or less, which is the typical recommendation for A1C. But some endocrinologists are feel satisfied with an A1C below 7. Many of them will stick with the 6.5 or less, but some may actually be okay with 7 or less. It totally depends on your physician and their comfort level and your history and working with them. So everyone's going to have a different recommendation. And the ranges during pregnancy, they change a little bit sometimes, but I think they're still have to have a fasting blood sugar of 90 or 95 or less. And then after eating, 1 hour after eating, having a blood sugar number of 120 or less. No, I'm sorry, 140 or less. And then 2 hours after eating, having a blood sugar number of 120 or less, which is very, very strict, I feel like. And most people feel this way.
Well, it makes me laugh because I'm like, okay, I can try. Like, it's just,
Yeah.
how do you, especially for fasting, that one gets me because I never seem like I wake up
Yeah.
above 90 all the time. So I'm like, how do
Yeah.
I do that?
Yeah, absolutely. I feel like the fasting numbers for me during pregnancy were the toughest and were always the thing I was working on and focusing on. What did I eat before bed? How was my sleep? How much water did I drink? How much exercise was I doing? Like everything can affect it. And I feel like that was the thing I was tweaking the most, the fasting blood sugar number. But certainly now that I'm not pregnant, I feel like hardly ever see that number. It's very challenging. And then,
Yeah.
yes, you're right with the blood sugar numbers during pregnancy. I felt the same way when I heard them. I kind of laughed. I was like, are you kidding me? That's like straight, like, that's like no difference. Like, am I not supposed to eat? Like, are you kidding? Am I supposed to cut out foods like no carbs? Like, how am I going to do that? But something else to consider, and this is often left out, the fine print, I feel like, and most doctors will be really good about sharing this. Those blood sugar ranges, the typical recommendation from, I believe, this is written in the most recent, I think, diabetes care report from the American Diabetes Association, is to stick with these numbers as often as you can, or 70% or greater. So not 100%. So not 100%. We're not going to see these numbers all the time for a variety of reasons.
Mhm.
And I think that's important to remember, because I think when we hear those numbers, we think all the time, 100%, all or nothing, but really it's, blood sugars can be up and down, and things are going to happen, and that's okay. We're aiming for 70% or greater. And I think that feels more achievable.
Definitely, because I can imagine like if I eat something and I accidentally go to 200, I would be freaking out, like just trying to do everything possible to get it down, which I guess is a good thing, but I don't want to be
Yeah,
freaking out about that number. When I'm
exactly. Exactly. Things happen. Yeah, we miss boluses, we misjudge carbohydrates, we're not, activity affects us a different way. Like, we're human. We're human. And I think that's one of the biggest things, and probably the biggest piece of advice I would give someone who is pregnant with type 1 diabetes, or something to remember, is to give yourself lots of grace, because you're working so hard. You are taking care of this baby the best you can already inside your body. It's a lot of pressure. It's a lot of work, and it's tiring, and we are human, and we make mistakes intentionally or not, or there are a lot of things out of our control, like pregnancy hormones. Sometimes we can't control our sleep with pregnancy, because it's hard to get comfortable. We have hormones surging in our bodies that don't allow us to sleep. We're doing the best we can. Many of us have other things going on, like work and maybe other kids and family and friends. How do you balance all of it? So, absolutely, considering that you are putting in the most amount of effort you can, and things are just not always going to fall the way that you want, but that doesn't mean that you're doing a bad job.
Is there a trimester that you would say is like more tough than the others?
Yes, I would say that about the middle to end of the second and most of the third trimester typically are the toughest during pregnancy, because that's usually where insulin resistance kicks in.
Mm.
Pregnancy hormones are surging, baby is growing, a lot of things are happening, good things, normal things. But it tends to, those hormones that are naturally occurring during pregnancy, and they're at a very high amount, tend to really combat with the work that insulin does. And we find that we have to take more. We might have to adjust what we're eating, how we're eating, the times that we're eating. I feel like that's definitely the toughest time, and can be the most frustrating living with type 1 diabetes.
Interesting. Yeah, that's crazy. And then I have another question about traveling. So, because I know we're technically considered high risk pregnancies.
Yeah.
Are you allowed to travel during that 9 months, or what does that look like?
Yeah, I feel like it. I feel like you are, absolutely. I wasn't restricted. I think I was restricted with travel towards the end of pregnancy, like maybe after week 34, possibly. Every doctor is going to feel differently about traveling by plane, by car. Usually the recommendation is to, because sometimes pregnant women can be at risk for vascular issues, or potentially blood clots, like with flying. So certainly having a plan of getting up and moving around, if needed, if traveling later in pregnancy. I wasn't restricted before that point, but of course, everyone's health conditions will probably be a little bit different, and they might have different restrictions put on them by their medical team. But no, even with a high risk pregnancy diagnosis, I feel like I wasn't restricted until the end of pregnancy, where they were just suggestive of not traveling too far away in case baby decides to come maybe a little early.
Okay, that's good. I didn't know if it was just because they're like, you never know when you're going to need to come in, like, just for health reasons. So, because I was reading about it and it said like, do not travel by road or plane. I'm like, by road. So like, I'm
I
stuck in
know.
a location for 9 months.
I know, exactly. I know. I had asked some clarification on that because we had like a planned trip, towards I think the middle of pregnancy, and the suggestions I were given, like, oh, it's just plan to get up, if you're going on a long trip, plan to get out of the car and move around and stretch your legs. You can sometimes feel stiff, and they do like for you to make your appointments most of the time, but my office was also flexible because, like I said, in both pregnancies, I had planned travel, and I think I missed an appointment both times. Especially towards the end of pregnancy, you have quite a few appointments, potentially weekly, potentially multiple appointments in a week. And honestly, I couldn't make them all because I just had other things going on. In my office, because I was fairly stable and my visits were pretty smooth, they're like, it's okay if you have to miss. I don't know if every office will feel that way, but mine was pretty flexible, which was nice.
Oh, that is very nice to hear. I'm glad to
Yeah.
hear. So what's like one main piece of advice you'd give to somebody who's looking to get pregnant that lives with type 1 diabetes?
Yeah, I feel like someone who's looking to get pregnant, I certainly I would do the best you can as far as researching type 1 diabetes and pregnancy ahead of time. There's actually more than when I was like looking into pregnancy. There's more specific information about type 1 and pregnancy available now online, which is great. You could always consider working with someone like me as well if you feel like, as I have multiple coaching programs available. I have a group coaching program, which is so nice because you get to work with other women who have type 1 or they're very much in the same boat and have a lot of experience and also support to offer on their own. And then, or if you also have specific goals, maybe for your A1C or balancing your blood sugar curve, it might be helpful to work with someone like me because I remember feeling like I had to push my pregnancy plans a little bit because I just wasn't getting to my goals fast enough. So
Mm.
sometimes that can make the difference between, your timeline with getting pregnant. And again, like I said, I think it's important to make sure that you are being really gracious and graceful and just being very forgiving with yourself because type 1 is such a difficult disease to manage. And I know that you're doing the best, that everyone is doing the best that they can with it, but we have off days, we have off days, off weeks. We have things that we can't necessarily control. So I often encourage like control what you can, but understand that there's factors that we just can't, and we have to sort of let that go and do the best that we can with it, which is challenging. I think we want to be able to control as much as possible, but
Yeah.
especially in pregnancy, it's just not going to be the case.
Interesting. Yeah. And then I actually just thought of another question because I get this question all the time from just like friends that don't know a lot about type 1. Like what are the risks that your child will, and I'm sure this varies by, everything, but like what's the risk that your child will get type 1 diabetes?
Yeah, that's such a good question. I feel like I get this question a lot too, and I don't have the specific information, but I feel like it's actually lower than it seems. It seems like, oh, well, your child will definitely have type 1, but that's not the case. I mean, certainly with us having type 1, we may potentially pass it down to our children, but it's not a definite. It's not a definite. Both of I haven't tested either of my children, but they both, neither of them have it or are showing symptoms of it. But certainly I was diagnosed much later in life. So it's something that could come up later and I'm always prepared for. I believe that the T1D exchange actually has some helpful support for this particular topic and actually has some testing options that are available if you were interested in testing your child at some point. But do know that testing isn't always foolproof either.
Mhm.
It may show a result that actually doesn't come about. If they show that the child could test positive, it may not, or vice versa. But I do think that it's actually lower than we think. And also, people ask me, like, well, what would you do if your child has type 1? I was like, well, that would certainly be really challenging. And I've talked to a lot of mothers who have type 1 and also have type 1 children. I mean, talk about like a lot of work. And also, they're just like total saints for like all that they do and work on. But I also feel kind of like confident and at peace with it. Like, well, if my child had it, I feel like I'd be the best person to help them with it because my parents still struggle with supporting me. Like they still don't really, I was 19, so it was always on me and they don't really understand it completely. And I feel like I'm always educating them, but it doesn't really stick. And at least I know that I could totally support my children really well if they were to need my support with this. So I do feel good about that.
Yeah, I agree completely. And my parents are the same way. So I totally get that. And yeah, I think having a parent with type 1 would be life changing, especially now with all the technology. I mean, it is what it is. So
Yeah, absolutely. I do think I talked to someone recently about type 1 diabetes, honestly, like at a restaurant. It was like spotting someone in the wild, like a type 1, someone with type 1 in the wild. I was like, oh, hey, I see your pump. And this person and I, we just met, but we were talking. We're like, gosh, isn't it so much better now with all the technology that's available? As far as a new diagnosis, like we just remember, when we were diagnosed and there wasn't a whole lot of information or support, but now it just feels like there's a lot more. And I was like, yes, at least there's that. It's not a super fun diagnosis whatsoever at any age, at any time, but I feel like things are looking up and that's nice.
yeah, absolutely. Well, thank you so much for being here. How do people get in touch with you if they want to learn more about your programs?
Sure. Thanks so much for having me. It was really nice chatting with you, Samantha. And if people want to get in contact with me, I'm on Instagram at type1diabetes.nutritionist. I also have a website, lemmabrownnutrition.com, and people can also email me at lemmabrown.rdn@gmail.com.
Awesome. Thank you so much.
Thank you. I really appreciate it.